So exam one, one of the things I want you to really to pay attention to is your theorists. There are quite a few questions about theorists, and I'm going to go over that in the PowerPoint. And remember, always growth and development, stages of development. These exams are built up by each professor. They're all different. They all have similar, they're all the same concepts, similar questions on them. So it's not just one way to think about it. Remember how you could ask it negatively, positively, or with making it what all of that is applies, or what couldn't be, what would a kid not be able to do? These are things that you have to start thinking like that, okay? So with that being said, let's go ahead. Let's get started. I know that you are busy and I don't want to take up any more time than possible with y'all. So let's do this. This.
Professor Bogart, are we able to print these out while you're doing them so we can follow along?
What do you mean print out?
There, it's a for the PowerPoints.
I know
So
my professor posted them already in our
They
exam
should have
review.
all been posted.
are you so you all the original PowerPoints
They
were looking
are
at?
completely the same
Okay.
because concepts don't change.
Okay,
Questions
so
change on the same concepts. That's the premise. So I know a lot of you heard, oh my goodness, we've heard it's all different exams. It is. They're not the same like they used to be, and everyone the same. They're all a little bit different, but they all are covering the same things. Okay? So this is a lot of chapters. Now you have got your PowerPoints, you all have the Kahoots that I've made, and all of those things will help you through this, okay? Now, there's always definitions that you need to understand, and there's a lot of them, okay? I'm going to try to explain them to you, not just read them off here. So, cephalocaudal, now, what does that talk about? Well, cephalo is cephalic head, and caudal would be toe. And that talks about a kid lifting their head up by 3 months, turning over from front to back to front by 5, 6 months, 8 months sitting unsupported, 9 months pulling themselves up, and then creeping, and then proceeding to almost walking or walking by 1 year old. That's cephalocaudal. Proximal distal talks about they first know things here, infants, and then they go to the outside. So first they play with stuff here, and then they start realizing there's stuff somewhere else. General Pacific is the ability to perform general body functions, and that could just be grasping and turning and cooing, etc. Maturation. Maturation is the total way in which a person grows and develops, as dictated by inheritance. It's, how do you mature? How do you understand? It's all part of, where you grew up at. Growth is just getting bigger. Development is taking and having just that reflex palmar grasp at birth, and then going to voluntary, and then to crude pincer, and then putting and taking out blocks out of a container, and then building a block of two. That's just part of that. When we talk about hereditary, that's just what you have. Are you going to be tall, short, history, prone to cardiac diabetes? All of these things come from hereditary. Nuclear is a type of family, and that's what we consider the woman man who marry, have children, and they never divorce. They're together forever. That's a nuclear family. Extended families is when you have grandma, grandpa, the cousin who comes to live with you, the aunt, who's whatever, more than just a family. Blended is what I have. I have a son and a daughter, and my husband has 3 daughters, and together we are blended. Alternative is more like the communal or like church families is a really good example of that. Now, extrusion reflex. When you first take a spoon and put it in that infant's mouth, their tongue sticks out. They don't know what to do. All they know how is to suck, swallow, and to breathe up to this point. Remember, they're just 6 months old. They're learning, they're cognitively becoming more aware. And you put it in, it sticks it out, and eventually that will go away. The grasp reflex is what I just said. Is when you touch the palm at first, that reflex is to go ahead and grab it. And then they end up grabbing it themselves and then go to the pincer, grasp the crude and the real one, et cetera, et cetera. That's what the grasp was talking about. Prehension is the ability to grab objects between the fingers and the thumb. It's very much like your pincer, right? Now, that parachute reflex starts about 9 months. And this is when children put their hands and their legs out when they're falling. They protect their heads. Ever take an infant around 9 months, turn them on their tummies to put them on the floor, their hands and their legs come out. That is parachute reflex. We all have it. That's why kids get broken wrists a lot, because their hands are coming down like that. Negativism. Ritualism, toddlers, negativism with toddlers. They're always saying, no, 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 mine, 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 mine. And absolutely normal. And ritualism is doing the same thing all the time. It's when you have a schedule. The toddlers love to be on a schedule. They know what's coming next. They feel secure. They know after they eat breakfast, they're going to be getting dressed and they're going to play. And then they know maybe a little bit later they'll get some juice. And then they know they're going to have lunch and take a nap. And they know what's coming next. Personality is all those things that make a child who they are. We have those happy personalities. We have those children, who will be more distant and quiet. But personality is that unique organization of characteristics which show you what a kid is like. Because you've got the happy, playful kids and the quiet ones. Parallel play is absolutely, again, toddlers. Toddlers play next to each other, parallel to each other. They play with their own toys and they're not going to share, period. They'll play on their own because it's mine, mine, me, right? Also, egocentrism. They call it egocentrical, egocentrism. Ego is me. I don't think about anybody else but me. And that's what, again, is a toddler is. They don't open their minds to something else yet. They're not old enough yet. So Freud, one of the theorists, now he's more on those psychosexual sort of type of categories. Now, as an infant, what do infants do? How do they self-soothe? They put stuff in their mouth, whether a pacifier, their finger, their thumb, a rattle, and they explore the world through their mouths. So it's all about being oral. And you put something in a kid's mouth, an infant who's fussy, like the pacifier, they calm down, right? That's why we call it a self-soother. Anal stage, why are the older toddlers, ages 2 to 3, why are they anal? Well, we start potty training. And with potty training, bowels start before the bladder. We know they need to have that urge to pee and to, move their bowels for it to start to be ready. And also they need to hold their urine for 2 hours before that potty training. This is some of the things that they have to, one of the 3 things. And the other one is the desire to please. And usually they want to either please their older brothers and sisters or mom or dad. So bowel comes first, anal. Then we get to preschoolers. They start to get more attached to their moms, boys, and girls to their dads. And they call it stage. It's more like, that opposite sex and understanding each other. Latency is a word. I don't know why the word's latency, but this is what we call about children at school age. Their friends are same sex. It's same-sex peers, and same-sex peers do have a lot of influence over the other child. So if one kid wants to go out for sports and he wants to play baseball and the other kid wants to play soccer, well, one might give in to the other so they're both still together. And then we know genital is adolescence and all they're thinking about is, their body parts, and that exploration and that sexual exploration. So Freud's stage of orality, infants explore the world through their mouths. We know all things go in their mouth. Fingers, blankets, toys, it don't matter. Anality or anal is all about
I think she's frozen.
I think she froze because she went from anal
Yeah.
and that was all.
I thought it was mine. I'm like, I'm taking my Bluetooth off. Professor, you froze.
You still freezing, my dear.
She left.
She'll log back
She'll
in.
come back.
Very
It's
soon.
her
Yeah, very
Wi-Fi.
shortly.
Phew. There she is.
Bless you.
Bless you.
Thank you.
there you are. All of a sudden I clicked a screen and you were gone. I apologize. You did the right thing. Just wait for me. I will be back. Good job. Thanks, guys. I love internet. Okay. All right. We were just about to talk about Piaget. Now, Piaget is all about how you think. And we have to start small and then we build upon it and make it more and more. You're thinking more and more. And critical thinking is the end part, which they call abstract thinking, which is the formal operations. So, infants at first, what do? Well, all of a sudden, they grab that rattle and all of a sudden it moves and it makes and they go, "Oh, I like that." So they were learning something. Then they take and they put the rattle in their mouth, and they love the world through their mouth. So that's part of that. It's also they start to coo, to talk. They're starting to understand that they can express themselves that way. Small infants are smarter than you realize. And then object permanence, which is even though something's hidden, they've seen it, they know it's there, even though it's hidden, they know it's still going to be there. And this is what we do on tummy time. We show it to them, put it in front of them, then they try to crawl, right? And they try to get you there. All right. What I'd like to do is take me off of there. That's better. I like to talk with my hands, sorry. All right. Pre-operational now is starting to think more. We're starting to take all of these little things we've learned about, the pleasure of the mouth, the pleasure of, things and knowing that's there on tummy time. I can still crawl and wiggle to get there. And it's what you want to do. Pre-operational is more symbolic. Children like to think that, the leaves cover the trees so it doesn't rain on the tree. They make brooms into horses, these sort of things. They also understand things like they throw their sippy cup on the floor from the high chair and mommy was away, mommy's going to come back and pick it up. Usually they do that to call them back because they want mommy to watch them. And then by the end of pre-operational, it's in down to school age, observation is developed. And that's when they know that a ball of clay is big and then you smush it small, it's still the same amount. Or we understand that, a tall glass or a short glass, you pour one into the other, they're the same amount. We know that younger kids think that the tall one is more and the short one is less, but it's the same. Well, this age starting to know that it's the same. Now, the two type of developments that are always confused is concrete and formal operations. Think about concrete as something that's solid, that's seen, you can touch, smell, and feel, okay? Concrete, you've seen it before, you know it before, and you can use that, whatever it is, in your everyday. Now, formal operation is that what we call abstract thinking. This is that child who can, without seeing things before, can, as I call them, because these are adolescents, they can fight their way out of a paper bag. They can figure what mom said you're not going out on Friday night because you did this last weekend, whatever. The kid really wants to go out for this adolescent. So they think of all the things that they can do, fight their way out of a paper bag, to make mom change your mind and let me go out. Abstract thinking. School age children don't have that yet. It's only into the, and so school age need to see it and touch it. And the formal operations, they can figure it out themselves. It's abstract. Now, Piaget, I've already given you some examples about the whole thing. So I think that the difference between, starting with just understanding and building on it, and then, the way that their minds and magical thinking is the pre-operational, and then concrete operations. It's like, I've seen it, I know it. Why is these happening? I mean, why did I get sick? Well, I did something bad. That's always a school age child. And then of course your formal is they're going to figure it out to get what they want. Erickson's probably the most tested of all of the theorists, whether it be on exams, whether it be on HESIs, whether it be on your NCLEX. It's really one of those that you really need to understand. So the first stage is trust versus mistrust. Well, an infant cries. What happens? Mom, dad, somebody's going to go pick them up. They need change, they'll be changed. They need burp, they'll be burped. They need to be fed, they'll be fed. I mean, whatever it is, that is trust. They trust. They're happy, social babies because their needs are being met. Mistrust is in those families where they don't get their needs met. It could be a house of abuse, drug abuse, alcohol. It could be, violence in there, or maybe homelessness or something where they just can't get there. And then that child is going to get more distance and they're not going to be happy because their needs are not being met when they want it. Now, toddlers. Toddlers is an important category. And what is autonomy versus shame and doubt? Well, autonomy means autonomous, means me, what I want. I'm going to do, I'm going to figure it out. Me, mine. What is shame and doubt? Well, what do we do to toddlers when they're climbing up the back of a couch, ready to jump over to another one? You know they're not going to make it and they're going to fall. Somebody's going to say, hey, be careful, stop, don't do that. You're going to hurt yourself. There are children who are never able to explore. Toddlers are the most inquisitive explorers on the planet. They like to get in, around, and over on top of everything. And it's part of the learning, the cognitive learning. Now, preschoolers isn't tested as much, but it's all about trying to help and not being able to know everything. The next thing that's really you'll see everywhere is the school age, the industry versus inferiority. So, how do I explain that? Well, Erickson says that children do things well, many things they do well, and that any task they master, whether it is spelling, cooking, whatever, running, jumping, they're the fastest. That's their industry. That's their building. That is their house that they've made theirs, their industry. So, what's the inferiority? Children can't do everything right. They can't do everything. So, when the things they can't do, they feel inferior. Okay? So, industry, the house I built, the stuff I do well. Inferiority, I can't do that. And I really wish I could. And then the last one is the adolescence and its identity versus confusion, role confusion. But basically, adolescents are trying to figure out who they are. They're so confused. Where am I going to school? What do I want to be? Do I like girls? Do I like boys? Do I like both? What group do I fit in? The band group, the sports group, the art group, the theater group, right? They don't know yet. And they're going, and it's all confusing. And they're all about body image. What do I look like? Too fat, too skinny, my hair's too short, too long, too curly, right? All of those things. So in the infants and Erickson, it's all about children having trust, and it really makes them really happy. And now you've got a good, healthy personality. Toddlers a lot of times want to feed themselves. The spoon is backwards, upside down, the food's going everywhere. So the parent just goes ahead and feeds them. That's not what we should do. We need to let autonomous themselves, let me try. And as long as they're trying, actually, that's okay. And another thing is, potty training. They like to go in and start and to learn. And when they do it, they like to clap, right? Preschoolers in their stage is initiative and guilt. Again, they can do a lot of things well and they like to help, but they can't do it all, so they don't feel good about that. And again, school age, what I do well and things I can't do well. Industry, I do it well. Inferiority, I can't, and I feel bad about that. And then the adolescents are all about who am I? What am I going to be? And every part of their life, okay? Maslow is all basic needs of life. And the initial is all about physical needs. Do they have housing? Do they have food? Do they have shelter? We would say vital signs and, those things are heart rate and temperature. We need all those things. And then it goes up to the top where it's esteem. Now, esteem is, let's say I go out for the soccer team because I know I'm good at that and I do well. Well, that gives me esteem, right? So it should be encouraged. Or the kid who's good at math to enter the math, club, or spelling in the spelling bee. What they do well, potentiate it. That so Maslow is all about what you need, and it starts from the basics and it works up to the feeling good, that esteem. Now, Kohlberg, whenever you hear moral or morality or good and bad, and there's going to be a consequence for each. It's all about Kohlberg. Now, we start out initially, I mean, infants don't know right or wrong. As they get older, they're starting to understand reward and punishment. They do something good, they're getting rewards. School age children want to do good, they don't want to do bad things. That's school age. And that is the areas, that you'll see looked at. We know adolescents have to conform to society. If they're driving a car, they have to stop at a red light. If they go somewhere, it's please and thank you, or whatever society dictates as normal is what they have to do. So that is Kohlberg, right and wrong, and a consequence for each. And then it gets to the school age who just wants to do right. They don't want to do bad things or wrong things. So infants. Well, when infants are born, the first 28 days, they're called a neonate. We know after that 4 weeks to 1 year old, that's what we call an infant. So neonate, the first 4 weeks, then it becomes an infant. How do children gain weight and height the first year? Well, a lot is what I'm saying. They should double their weight by 6 months and triple by the first year. Born at 7 pounds, 6 months, they should be at 14, and at 1 year, they should be at 21 pounds. They're going to be plus or minus a little bit, and big differences would be something that the physician would do some intervention, whether they're not being fed enough or feeding over too much. Those are things that will be either giving more or taking away. Every month for the first 6 months, they grow 1 inch. So it's 6 inches in 6 months. I mean, we never grow this fast again in our life, right? Another thing, by 1 year, they should be taking independent steps or that attempt. Not all children walk 1 year old. Some of them are a little bit later, some are earlier, but the textbook definition should be taking some or attempting some steps by 1 year old. Teeth come in all different times, but again, your book says 6 months is when usually the first tooth that you will see. Again, it doesn't mean every infant will get a tooth at 6 months. As in, my children didn't get any teeth, and at 15 months, they had 8. So it's all different, but you could feel them there earlier. For the first 6 months, they should be eating breast milk or iron fortified formula. By about 5 to 6 months of age, we're going to start introducing food. And our concern about introduction of food is allergies. So the first one to start out with, rice cereal. It's the least allergenic food that we have. So we start that. One of the things that parents, mothers get upset with is when they don't want to breastfeed and they have to bottle feed for whatever reason. We as healthcare professionals, we really need to support that. It's okay. They're getting iron fortified formula. They're getting the nutrition that they need. I mean, of course, breast milk and all of the immune stuff with it is better, but if that's what they can do, it's okay. Some parents like to make their own food and not go get those little bottles of fruit and whatnot in the store. We start adding this at 6 months, 5, 6 months, and we do one food every 4 to 7 days, making sure there's no allergies. And allergies could be rashes, diaper rashes, vomiting, constipation, diarrhea. Something different will happen to the infant, and you will know. Some of the parents want to make their own food. There are specific things and guidelines. Never add salt or sugar. Remember, honey. Never, never, never before age 1. You worry about botulism with honey, okay? Food should be cooked until they're tender with the littlest water you possibly can. And because you want nutrition, you don't want water, empty calories. So you should strain it so that you only get the food, put them in an ice cube tray, and you take one at a time. You only need 1 tablespoon of food per year of age. That's all they need, and that's essential for knowing your toddlers. So the infant, we know it's the trust that starts. It helps with them. We know that sensory stimulation helps with thought process. It's all about Piaget. Techniques to cope with a lethargic infant. Now, not all children are these alert, smiling, cooing infants. You've got some that are more lethargic, is what the book calls it. So these children, don't put them in big, bright lights. They don't want it. They don't want quick movement. They want it slow, gentle, and a calm voice, not yelling, not higher pitched, just relaxing. And then just sit with that infant, holding them sitting up in your lap, and it really keeps them calm. Healthcare maintenance are important, and we know that infants will be going to the doctors 2 weeks after they're born, 2 months, 4 months, 6 months, 12 months. That is just for immunizations. What do we do every visit? We do a height and we do a weight. And why do we know that? Well, we want to make sure nutritionally they're getting what they want. Also, we're going to be looking, is a 6-month-old turning over the weight they should? Is a 1-year-old almost attempting to walk? If they can't even lift their heads up, or called head lag, by 7 months, you should be holding your head up by 3 months. This is why we do these maintenance visits, to make sure that they're getting, checking these growth development stages, making where they should be. And if not, it's early intervention. It could be physical therapy, or maybe it's something neurological we got to look at. So we'll do that workup on them.
Professor, that would be like a developmental delay, right? And they're
Absolutely, developmental delays, a head lag, or the child's not turning over, it's 9 months old, or not sitting up by 11 months, or standing up by a year old. I mean, these are delays. They're definite delays. It doesn't have to happen at 6 months, but as long as they're doing other stuff, it's looked at the big picture. Now, sudden infant death syndrome is a big thing, something studied like crazy. I know down here in Miami at Nicholas Children, they have been doing a program and follow up on SIDS death on infants who have left the NICU since the 90s, and they still keep up with it. And there's been all different things in positioning they've said, but we need to know children must be positioned on their back on a firm mattress, nothing in there, no blankets, no cute little bumper pads, because it can cause it. That's the thing for SIDS, is on the back. Now, a lot of parents say their back of their heads are all flat, right? Because mommies don't want a flat head. So what we can say is they're cephalic, their bones in their head are softer. And when we put them on tummy time, they're up, they're trying to find that toy that's hidden with object permanence, right? It also helps round their head out too. So that's what I would tell a mother who'd be worried about flat head. Remember, appropriate car seats. They should be rear facing for infants less than, it's actually, let's see, rear facing infants should be used infants 2 years old, weigh in less than 1 pound. I mean, all of these kids, we don't turn them around to front facing till 2 years old and 30 pounds. So all of these kids, it should be in the center of the back seat. I know I always put it in the passenger side, right? Behind the passenger seat. But nope, they're saying it should be in the middle in case it's hit there. Remember, those straps need to be snugly snugged up tight. They shouldn't be loose if they do hold that kid properly because they don't have the muscular to support themselves. And if we use that nice, it's really cute, this big thing you can wrap the kid up and hold it, make sure that the kid can breathe because it could be smothering them, even though it's nice for the child, but it could be a little bit too nice. Toddlers, and nutrition is a big deal. They're picky eaters, and that's okay. One of the things that they say is we're giving whole milk at 1 year. And we know we do whole milk because it's good for, the central nervous system and growth and development. So overall, even feeding a child low-fat diet before 2 years old, it's not going to let them grow and develop the way they should. Toddlers are ages 1 to 3. So we've tripled our birth weight at 1 year. We quadruple it 2.5 years. So that's a year and a half later. So you can see how really, really slows down. Physical changes. We have the fine motor, which is all about fingers and the grasp and the pincer and putting things in containers and pulling them out. And then we have the gross motor, which is the get up, go, go, go movement sort of thing, which is walking and running and hopping and all those things as they'll do as they'll get older. And also, they're getting more good at switching hands and using and depth perception. All of that's a lot better. Their digestive system, which is immature as an infant, that's why we don't feed them for the first 6 months. And that's why you're still going to see some food in their stool after 6 months. I mean, even to your adults, you could see some foods like corn is one of the great examples. Even adults will see there. Remember, the toddler, the digestive process is getting a lot better. And instead of doing every 4-hour feeds, well, now it could be 3 meal snacks in between. Bowel and bladder control, usually, not everyone, but by the book, 2.5 to 3 years old should be done. Toddlers are that autonomous self. I want to do, I want to go, I want to do what I want to do. Remember, that's the autonomy versus shame and doubt. And that's somebody tell them, no, you can't do it, and doing it for them. Children that are toddlers, they come out infants, they're having one-word sentences. And toddlers are starting to be able to communicate more and more, and they're understanding more and more. They're starting to be more independent. They're starting to be able to walk less, clumsy, less awkward, and their speech is getting better and better. Now you've already done separation anxiety, and what is that? Well, toddlers especially placed in a hospital room and mom and dad can't be there or have to go home, you're going to hear that kid go through protest when that parent leaves. And that is the screaming, yelling, crying, carrying on. They don't want to be left alone. I don't blame them. They're scared. Then they get to the point of despair where they regress, suck their finger, maybe need a diaper, want a bottle. I mean, all of these things are part of despair. And then the detachment is they've been gone too long. Parents come in, they don't pay them attention. And that separation anxiety. The twos, the toddlers, the terrible twos, whatever you want to call them, they are a difficult time because of the exploration they're going through. And we need to tell these parents, it's hard when the child says no, 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 has temper tantrums. If they're having a temper tantrum, you've got to limit what they're doing at that temper tantrum. Just let them do it, but you don't want them to be hurt. So if they're going to hurt themselves, of course, we'll stop it. Sibling rivalry is huge. It's like they think they like the new kid better than me, the new baby, etc. And then any sort of discipline, what we'll do is timeout. 1 minute per year of age. Preschool, ages 3 to almost 6. This is their preparation to go to school. We know that their gross, their fine motor skills are getting more and more. They're getting better. They're getting more able to control their bodies. They're running, they're skipping, they're drawing pictures, they're getting in a circle, they're tracing shapes. All of these things are going on. Piaget says that they are thinking more. They're able to understand magically, and they're making things, those rooms, and talking about the animism, making trees into like a human or an animal type stuff. It's all part of what Piaget talks about. And then learning how to speak and what words he needs to use. Erickson initiative. That means they want to help. They want to help mommy set the table. They want to, put their shoes away, or, put their stuff in the laundry, or help with laundry, part of it. Again, Kohlberg, it's morality. It's all about right and wrong. And in preschool, it's more of a reward and it's a punishment, okay? Language is getting better. Their words, their sentences by the end of preschool are quite amazing what they come up with. Play is always a part of children. It helps with them moving, playing, keeps them thinking cognitively, it keeps them aware, and it's just good for communication, socialism, and all that. Now, cooperative play is usually the end of preschool into school age, and that's when they do something and somebody wins. There's a goal of the play, whether building a house or playing checkers as the older kid. And of course, their imaginative play goes on and on. They're sitting there talking to themselves. Social issues on preschool is all about being, we've got preschool going on. We've got them attending, for whatever hours a day, and they're starting to learn to share, right? They have to share things now, not like toddlers, they don't share. And if they want to get up and go or talk when they shouldn't, they're starting to learn to control it. They're getting ready for school. Parents are concerned about how to set a limit with a preschooler. How do you tell them not to do something? And how do you get them to listen, right? How to handle jealousy, and then also thumb sucking. Now, thumb sucking is okay. They say that we should stop whatever finger sucking. My daughter was this one by the time their permanent teeth come in, and that's after age 6. And we know that preschoolers are exploring their own personal being, and that's okay. They're looking at each other. It's just part of sexual exploration. And at that time, we don't yell at these kids. We just say, come on, let's go out and let's do this or do that. Change it. Just change the subject. Enuresis is bedwetting. Primary is when a kid has never ever been dry. And there are kids that go off till, later on in life, 6, 7 years old, who still need a diaper at night. And then there's that secondary, which is usually due uh, dry, potty trained all night long, no problem. And all of a sudden they start to wet the bed at night. Could be diabetes, could be urinary tract infection. There's something, it needs to be explored. Now school age, ages 6 to 12, time of independence. These children want to same-sex peers. They want to do things and they want to do them well, right? Of those things they do well is their industry, which is what Erickson says. And we know that inferiority, they can't do everything well. Freud is talking about children more of same-sex peers and working together as same-sex peers. Piaget talks about concrete operations. It's the way you think and the way you act is because of the concrete, what you have seen and touched before. You know what to do and you know how to act because you've been there before. You've seen that. Again, growth is really slow, but you're talking 6 years, so it's actually quite a bit if you add up all of them. School, very important part. They are being influenced by all sorts of friends and schools, teachers, and et cetera. It's a really important influence on them. These children, again, same-sex peers, and they start to that opposite sex around puberty, but in school age, it is same sex. And again, remember, they influence each other really a lot. Their language is going more and more, learning more words, communicating more effectively and efficiently. Their understanding. And what you see sometimes is the younger kids are saying some words that they don't put it really in the right context, but it's a big word that they want to use. You know, teleportation. It's been Christian, my word. And I don't know if he really understands exactly what that totally means, but it's an example of those sort of words. Morality, again, Kohlberg, what does he say? They want to do right. They don't want to do wrong. So even if somebody's doing something wrong, they're not going to follow in it. Most school age children, because they don't like that. Sports, physical education, and when they do well, should be encouraged for those children for that esteem, the top of the pyramid, right? You want to do that with Maslow's. So how do you address a child who's struggling for focus and attention? Well, number one is you listen, what's going on. Kids will reach out. When you see a kid acting out, doing things, usually something's going on at home. Adolescents are over the age of 12. It starts out with the puberty that we're going through. All the permanent teeth are in now. And we start now with those secondary sexual characteristics. And it ends with them becoming more mature. They're going to get to their, final height, usually by the end of adolescence. Again, Erickson's all about me, mine, identity, body image, et cetera, okay? We know adolescents and going out with their friends and their peers, we are now escaping the family, and now we have to fit in to the environment that they're in, and it's getting them ready to go off to college or to go move out of the house, okay? As I said, it's a period of formal operations. They can fight their way out of a paper bag through logic. They can make up things that sound really good or do things to get things they want when they're told no. And that's what adolescents do. You got to be really, really aware of those sort of things. Their physical development is going on, and it's all going to develop. Tanner stages is the one that we start out with girls, breast buds, and then everything occurs. And boys, it's enlarged testicles is the first developmental change. And then it goes and, they enlarge and they get bigger and they get hair everywhere and their voices change, right? We know that adolescents, that beginnings of it, they are doing growth spurts and this rapid physical changes. They're gaining weight, they're getting tall, they're starting to, turning into young adults, okay? Number one hazard and kills many adolescents, it's always going to be motor vehicles. Accidents, always. So how do you assess? Well, we know we have ADPI, assessment, plan, implement, evaluate. You should know how that's done and what it's about. Assessment, what did you see? Plan, what are you going to do? Implement, what did you do for that? And then, did it work? Okay, that's all ADPI. Denver 2, important. It is not an IQ test. All it does, it evaluates the personal, social, and fine motor and language skills to see if you need further investigation, further evaluation. It is not an IQ test, okay? Timeouts, again, 1 minute per year. Age 10 minutes, right? Your BSA is the most accurate method for making doses for children, okay? And how do we teach sex education to adolescents? Well, we need to give them that private time, what they need, and to answer the questions openly and honestly. Medications we know are given all sorts of children. We know we have to adapt them to their sizes. We give milligrams, micrograms per kilogram, or BSA. We know just like adults, absorption, distribution, metabolism, and excretion is slower. And we have to be aware of that, especially we're giving some really high toxic drugs, measuring all of the levels, making sure they're okay. Weights are always in kilograms because medications are given milligrams per kilogram, micrograms per kilogram, and you will see 2 of those examples on your exams, usually. IM injection, children and adults. You have the children's, young children is in the fastest laterus. And then the IM injection for adolescents, you know, you'll hear 2 things, ventricle and you'll hear deltoid. You know, just general IMs can all be given in the deltoid. There are a few, like steroids, put them in the ventrogluteal because it burns, okay? We need to watch children getting IV fluids. You guys are so lucky today. We have IV pumps for every single IV that you hang. And then we'll make sure that they're not going to get too much. It used to be that have a whole bag would go into a child and they go into congestive failure. That really doesn't happen today. But if you're just hanging it, making sure that child doesn't get those big fluid boluses that they don't need. Remember always, if an infant, due to whatever health concern, cannot eat, give them a pacifier. And the reason is it's for their growth, development, and it's self-soothing. I&O in children with diapers. How do we know how much came out? Well, each diaper weighs a certain amount. Well, number 1 diaper weighs 30 grams. All right. If you take a wet one off and put it on a scale and it weighed 60 grams, we know that the child had 30 grams, which is 30 mLs of output. So remember that we do weight measurements in kilograms. You're going to see milligrams per kilograms per dose. Know that weight of pounds is always a bigger number. I always tell my classes, I weigh 100 kilograms. I don't weigh 200 pounds because 100 sounds really good. That's kilograms. So remember, kilograms is smaller. Always know how to calculate the doses. And why shouldn't you give tetracycline in the first 8 years? I mean, it used to be the most popular antibiotic back in the 1950s. Their teeth turns gray. I had a nurse that I worked with, one of my first jobs about it, and there it is, gray teeth, and absolutely, she had tetracycline. Leading cause of death, we know has to do with motor vehicle and injuries. And what is a latchkey kid? When you have a kid who is a latchkey, this child is coming home, nobody's there, and there's more risk for injuries and loneliness. You know, they feel all alone at home. So those are things with that. Does anybody have any questions? I wish you all really good luck on your exam, and thanks for being patient with me.
Thank you, Professor.
You're very
Thank
welcome,
you,
guys.
Professor.
You're very welcome. Have a good day. We
Thank
have
you.
that dosage calc has been posted. It's a
Thank
great,
you.
listen to it if you need it. Yvette, it's there. Refresh yourself again. Have a great one.
You too. Thank you.
You're very welcome.